Welcome back to Connected Rheumatology. I'm Dr. Elizabeth Ortiz. If you're new here, I just want to say welcome. Thank you so much for joining us. I am a rheumatologist based out of Dallas, Texas, and here at the Connected Rheumatology YouTube channel, we talk about all things rheumatology, immunology, diet and movement, and mental health and wellness because we believe it's all connected. If that sounds like something you're into and want to know more about, make sure you hit subscribe, like this video, share it with anyone you think can benefit from this information. It really helps us out. We really appreciate it. Today we're going to be talking about what I'll say this. It shouldn't be a touchy subject. We're talking about when it's time to move on and find a second opinion. Second opinions are actually really common and should be encouraged, but I know that there's a lot of tricky feelings about it. So we're really going to get into the signs that maybe it's time to look for a second opinion and then what to look for in that second opinion. So stick around. Okay, so before we get into when it's time to look for a second opinion, I just want to highlight that everyone deserves to have a healthcare team that's engaged, that listens, and that works with you and within the paradigm of health that is best for you. And I think oftentimes we forget that we actually deserve to have a doctor who will work with us. And so that's really what I just kind of want to say off the bat, that if the relationship you have with really any physician isn't working, you deserve to go find one that works. You know, that doctor-patient relationship is just like any other work-related relationship in that it is two or sometimes more people coming together working towards a goal. And when we're talking about the doctor-patient relationship, the goal is really getting you, the patient, feeling better and more healthy. When there is mistrust or miscommunication or even just disorganization between the individuals in this doctor-patient or patient healthcare team relationship, it's going to be really difficult to reach that goal. And just like there are millions of different types of people out there, there are just as many different types of doctors out there. I mean, doctors are just people after all, and everyone has different personalities, different strengths, different weaknesses, and it's really important that you find someone that you can work with or, you know, that intangible that you click with. Not everyone is going to click, and that's perfectly okay. And for whatever reason, it may not be working or you may not feel comfortable, that's okay. And then the other point I want to make is that when the doctor-patient relationship isn't working, most times the doctor knows, the doctor's aware. And honestly, if the doctor isn't aware, then I would worry that that doctor isn't bringing their full head and heart into the room to be paying that much attention, in which case it's time to find another doctor. Okay, so then what are these signs I'm talking about? What are the signs that it's time maybe to get a second opinion? So the first one is when you leave your appointments, are you leaving with more questions and answers? Do you have a plan in your hands that you know, okay, this is what we're going to do? Or are you just leaving with this like confusion? Now, to be fair, in the world of rheumatology, confusion just kind of goes with it. It is not unusual to have confusion, especially when you first get a diagnosis. It's just a whole new world and there's a lot to learn. But the point here is, do you feel like the doctor or just the clinic, whether it be a PA or nurse practitioner or the nurses at that clinic, do you feel like that clinic has your back? And that, yes, you might have some questions and be confused, but you know you've got a place where you can go to get those things answered. If you don't, then it might be time to get a second opinion. Number two is you just aren't getting better. Again, this is tricky. When it comes to autoimmune conditions, the term getting better or the definition of getting better might not be what you hope for or what you want. And there needs to be a lot of frank conversations between you and the doctor about what this condition entails and what are some realistic expectations. So whether or not you actually aren't getting better or your perception is that you aren't getting better, both are signs that it's time to find a different clinic. Number 3 is you just can't get a hold of anyone and you never get a call back. Now, this one's a little difficult for me just because I know how clinics work. I know how busy the clinics are, and if messages or calls aren't returned, it's not necessarily because everyone's just sleeping on the job. And especially in times like these that we're in where there's staffing shortages, I'm filming this in the middle of Omicron, I do believe that we need a little more grace in this area than perhaps I'd be willing to accept in different times. But that being said, if you are repeatedly not able to get a hold of anyone or your messages are repeatedly not being answered, then it's time to find a different clinic. Okay, number 4 is a little less tangible, but it's this idea that the doc just doesn't get it. Now, as I said at the beginning of the video, there are just as many different types of doctors as there are people in the world because doctors are human after all. So as rheumatologists, we have a certain training and specialty that enables us to be experts within the field of rheumatology. But don't think that that particular person's experiences or belief system or point of view and perspective don't influence the way in which they deliver that expertise, because it absolutely does. The advice you are given by your physician in rheumatology and otherwise is definitely sprinkled with that physician's own experiences and belief system. Now, this is not to say that we don't have standards that we meet and that we haven't all received the same training and education. But that's where the art of medicine really comes in, is where we bring our human selves to the room. And from human to human, sometimes you're just not gonna gel, and that's okay. And that means it's time to find someone that you do gel with or jive with or click with or whatever word you want to use. And then finally, if your doctor doesn't have expertise in your particular condition, then it is a good idea to go get a second opinion. Now, this actually happens more than you might think in rheumatology. The field of rheumatology is very wide, and just even a brief overview of my channel, you'll see that there's so many different topics we can talk about, everything from osteoarthritis and fibromyalgia to ANCA and vasculitis and scleroderma, and then everything in between. And so it's not uncommon, especially depending on where someone works and the population that they serve, for someone to say have a lot more comfort and experience taking care of rheumatoid arthritis, for example, than compared to something like vasculitis or scleroderma. So if you have a condition that is more rare, it is perfectly legitimate to ask your doctor or your clinic, do you see this a lot? Do you have a lot of experience with this? And a good doctor will be honest with you, and if they don't, can refer you to a specialist in the area that does. All right, so let's say you've gone through the list and you're like, check, check, check. It's time for me to get a second opinion. I often get this question, do I need to tell the doctor that I'm going for a second opinion? You know, I don't want to hurt their feelings, or, you know, we just don't click, but they're very nice. The short answer is no, you don't. Again, like I said, a lot of times when the relationship just isn't working, the doctor knows, and you don't have to tell them. Now, if you are wanting to change doctors or go a different direction for a reason that you think would be beneficial for the doctor or the clinic to know, for example, if the clinic has just been unorganized or you haven't been able to get a call back and you think that it would be useful for them to know that information, then by all means, in a constructive way, I think that can be helpful. But you don't have to. Once you find your new doctor, they can simply request your records from the old doctor and it's done. Got a new doc. So let's just spend a little time talking about what to look for in this new doc. You don't necessarily want to have to go through the same thing that you went through already, although sometimes it can take a few tries with someone to really figure out if you're going to click. So what should you be looking for? So I always recommend personal referrals. So referrals from friends, from family, from people you may know who have your same condition or a similar condition. I think there's nothing that is better than that personal referral. So you obviously also want to look for someone who has an expertise in your particular condition. And this is especially important if you have a more rare condition. It's not uncommon for people to seek out second opinions at some of our bigger academic institutions, places like the Mayo Clinic, Cleveland Clinic, or if you happen to live in a city where there's a big medical center, that a big medical teaching hospital is also a place where you can go and find experts in the more rare conditions. You're also looking for a clinic that's full of people that are happy, that's well organized, where the staff stick around, and where your voicemails and your messages get returned. Now again, we're in a funky time right now, and so a little grace is required with this at the moment, but in general, a happy clinic means happy providers, which usually translates into happy patients. The next recommendation is really that kind of intangible, do you click? Do you feel comfortable when you're with the person? Do you feel listened to and heard? And it might take a few visits with the person to really best understand if this is going to work for you. Along with that, how does your provider, doctor, PA, NP, utilize the computer in the room? You know, there's a lot of talk about, oh, the computer is taking over the clinic, and oh, the doc only looks at the computer. And, you know, the fact is the computers are here to stay. The computer is not leaving the clinic room. And as physicians, we have to accept that too, because we're not always thrilled about it. It's a wonderful tool, but it can sometimes get in between this interaction between you and the patient, or the patient and the doctor. Aside from the idea that you're completely getting rid of the computer, which is just not realistic, how does the doctor work with the computer? Is it like it gets all their attention, or does the doctor have a good ability to balance what they do on the computer with how they listen and talk with you? And then ultimately, do you leave your visits with a plan? Even if it's just a small little baby step plan to get you to the next thing. Do you leave with a plan? Do you feel like if you have questions, you can get them answered? These are going to be the things that make for a healthy doctor-patient relationship that can move you towards your goal of being as healthy as possible. I just want to reiterate that your doctor, your rheumatologist, your rheumatology clinic are just tools to get you feeling better and get you as healthy as possible. Yes, they can be very important tools, but they are tools nonetheless. And if it's not working for you, you have every right to go try to find another healthcare partner that will work for you and with you. I hope you found this useful, maybe a little empowering. If you've been kind of on the fence, kind of thinking that the relationship you've got right now just isn't really working for you, but couldn't quite put your finger on what exactly was missing. Maybe you got some ideas here and feel now empowered to go off and look for maybe someone that can work for you better. If you like this kind of content, make sure you subscribe, share this with anyone who you know might be struggling with trouble with their physicians. Here at Connected Rheumatology, we talk about all things rheumatology, immunology, diet and movement, and mental health and wellness, because we believe it's all connected. Thanks and have a great day.